Hi, my name is Janelle Green, and this is my presentation for PC 700 about advanced maternal age mothers and the impact that it has on their pregnancy. So just for an introduction, advanced maternal age is also known as AMA, and it is pregnancy after the age of 35. Your reproductive years are usually considered your teenage years up until 35, and then after that, your pregnancy is designated to be advanced maternal age. A lot of misconceptions for AMA pregnancy is that these mothers have to go through some kind of intervention in order to get pregnant, such as in vitro, where the sperm and the egg are fertilized in a petri dish and then fertilized egg is inserted into mom. However, that is a myth. Advanced maternal age mothers can get pregnant through intercourse just as moms during their reproductive years. Although it is easier to get pregnant during your reproductive years because as we age, our reproductive organs age as well. And it can typically be a little harder, but very much so still possible. These pregnancies are considered high risk because of the factors that typically happen as we age. And this presentation is about going over those things. Being high risk literally means that these moms have a higher risk for adverse outcomes and should be closely monitored by a maternal fetal medicine specialist or a midwife throughout their pregnancy. So why are advanced maternal age mothers considered high risk? Advanced maternal age mothers have the highest incidence for maternal and infant mortality. I work in a high-risk obstetric population, and what I've noticed is the three most prevalent disease processes are gestational hypertension, preeclampsia, and diabetes. Although there are other factors that can be considered high risk for these mothers, these three disease processes are very big and very common. With gestational hypertension, we're mostly looking at mom's pressures, making sure they don't get to severe range. With preeclampsia, we look at the protein levels in the urine as well as blood pressures. Those two definitely have the biggest impact on placenta in getting the necessary nutrients and blood flow to baby. With gestational diabetes, a glucose tolerance test is administered around 28 weeks gestation, and we're looking to make sure the blood glucose levels don't rise to a severe range as well. All three of these disease processes affect baby directly, and your physician might decide that at a certain point in your pregnancy, if you're diagnosed with any of these, that the baby is safer outside than inside of a hostile environment. So they may have to decide to deliver early before 37 weeks of gestation, which would be considered full term. So that flows into how does AMA affect the fetus? The fetus can be directed directly by premature birth. So with the baby being born prematurely, most likely the baby will have a long NICU stay due to developmental issues. Respiratory issues are huge. The baby may have to be intubated or have a CPAP to aid with breathing, along with other things that could play into developmental issues. Blood flow issues with placental insufficiency, as well as blood glucose complications affect baby size. Large for gestational age baby and small for gestational age babies are usually what we see with blood glucose complications. And so the baby will have to be monitored once the baby is born to make sure those levels don't get to a severe range. So all of this sounds so scary. So a lot of advanced maternal age mothers wonder what can they do to improve their outcomes. The biggest thing the mom can do is to establish obstetric care in the first trimester. Very important to basically go ahead and see what's going on with the pregnancy. If the pregnancy is where it's supposed to be, meaning it's not ectopic, it's in the uterus, and the baby is growing on target. The doctor may decide that there needs to be blood tests done early on to determine if any kind of genetic issues are going on, as far as Down syndrome or trisomy 21 are the biggest ones with advanced maternal age mothers. And also lifestyle changes may need to be addressed. For example, if smoker, smoking cessation needs to begin, alcohol consumption needs to stop, and determining whether mom is okay to be physically active during pregnancy is something that should be discussed as well as diet changes, definitely making sure mom gets folic acid in her diet, vitamin D, taking her prenatal vitamins, staying well hydrated. These are the conversations that need to go on in the first trimester so that mom can follow this regimen and have better outcomes. And also, as far as a regimen goes, within the pregnancy, if mom is diagnosed with gestational hypertension, diabetes, or preeclampsia, a new plan needs to be established on what medications mom is going to be taking, how to be compliant with these medications, when visits need to be, and how often that she will need to be monitored. In conclusion, we discussed fertility issues may arise with advanced maternal age mothers. However, pregnancy after 35 is still possible. Advanced maternal age mothers and their babies have the highest incidence of maternal and fetal mortality because of several different diagnoses. The ones we discussed, gestational hypertension, preeclampsia, and diabetes, are some of the most common. And with a diagnosis like advanced maternal age in general, to seek obstetric care in the first trimester of pregnancy and make necessary lifestyle changes. For example, smoking cessation, stop drinking alcohol, and physical fitness may be okay for mom. This concludes my presentation. Thank you so much for watching.